morning, Professor Lopez. How are you?
With regard to Colombia, they got involved because what we wanted to do in the Bloomberg initiative was not just take countries that had really poor systems, but also take countries that had systems that weren't functioning to give the information that they needed for policy, but were pretty good. But being pretty good in terms of public health is not good enough. The program in Colombia has been very much developed by the Colombians. They have understood the kinds of expertise that the Bloomberg initiative can bring and the University of Melbourne has available. They've understood the gaps in their system. So it's a very good ground in which we can bring together these research advances with IT, with the Colombian experience and the expectation that they have about what it is that they want to see developed. And I'm really delighted that we've been able to work with Colombia because they're a very well-educated population. They understand the value of good quality statistics and policy, and they've got areas of improvement that we can work on that are quite focused, that depend heavily on good research results and science, and so they're a little bit of a different challenge to what we're doing elsewhere. So what we're doing generally in all countries is to try to do two things in terms of strengthening systems. We want to strengthen practices, make sure that the practices that countries are using to generate data, to store and consolidate data are the best possible things that they can be doing in terms of quality. The other thing that we're working on is people. We're working on building the capacity of the people in the CRVS system, the vital registration system in countries, to be able to analyze data, to critically appraise data and say data don't look correct. So we're teaching them that capacity. One of the things that we're doing here is working with the medical doctors who certify the deaths. And at the end of the talk I gave yesterday, I had a medical doctor come and talk to me and say, well, I'd never realized that this is how we should proceed with filling in death certificates. I never realized that it was the information about the initiating cause that led to the sequence that led to death that was really important for public health to prevent. I'd just been writing the quickest thing that could come to mind. And in Colombia, about 85% of the deaths that occur in the country, we estimate, are being registered and captured by the system. That's good, but we're still missing 15%, and they will be a biased sample in the sense that they'll have a different cause of death pattern than the 85% that we are registering. These are hard to get. These are typically remote deaths, deaths in poor areas. So we're trying to use some of the innovative practices that we've developed under the Bloomberg initiative to help the country capture these deaths cost effectively. In other words, if Colombia is going to have a data system that will benefit all the population, we need to try and reach out to those missing populations and capture causes of death cost effectively.